good evening. How are you? Wish you are fine again. Back to the ageless face, ageless mind. Ageless face, ageless mind. The color of ages. Just thinking of caramel makes many people's mouth water. But caramel coloring, a popular coloring in sodas such as colas and many other foods, is actually burnt sugar, which is both carcinogenic and immunosuppressive. The FDA is aware of this and mandates that any food or beverage containing caramel coloring must list it on the product label. Unfortunately, most people are not aware of this darker side to a substance that sounds harmless, but is in fact toxic. Caramel coloring is also a source of exogenous AGEs. When combined with the sugar and or high fructose corn syrup found in sodas, we are getting a double dose of AGEs. Drink a cola along with a heaping plate of French fries and carb-broiled grilled hamburger dosed with high fructose corn syrup, sweetened ketchup. Well, I think you get the picture. The popular combination is a serious contributor to accelerated aging and age formation in all organ systems. This is important for children as well as because ages accumulate with age, and food like this means that they will get an early start in age accelerating glycating compounds. Growing age-related epidemics. As the world's population both increases and ages, the number of people who are affected by age-related disease increases as well. Finding successful therapeutic strategies to combat Alzheimer's disease, dementia, and diabetes has never been more important than it is today. It's mad world. If you sometimes think that the whole world has gone crazy, you may not be too far off the mark. A study entitled Global Prevalence of Dementia, a Delphi Consensus Study, estimated, it is written by Ferry and others, estimated that 24 million people worldwide have Alzheimer's disease or some other forms of dementia, with one new case every 7 seconds. It means nearly 4.6 million new cases every year. And that is not only bad news. It is estimated that the number of people affected by the may double every 20 years. The authors said that in the year 2001, some 60% of dementia cases occurred in developing countries, and that this proportion may rise to 71% by the year 2040. A major culprit in the rise of Alzheimer's disease and other forms of dementia is the adoption of the Western lifestyle by developing countries. As our ubiquitous, fast, and convenience foods pop up around the world with increasing frequency, they are taking the place of natural, healthy, native cuisines. The number of dementia cases occurring in their populations is forecast to increase 100% by 2040, and to increase more than 300% in India, China, and their immediate neighbors. Although longer life spans contribute to Alzheimer's disease, many observers attribute the rapid worldwide rise in dementia rates to the increasing dominance of the standard Western diet, which is low in protective dietary factors, fish-derived omega-3 fatty acids, fibers, and plant-derived antioxidants, in place of these life and health benefits. Western foods are high in fat, sugar, and calories, making these foods high in age-forming properties as well, and age formation plays a significant role in Alzheimer's disease. Fighting age and the related inflammation is the best strategy we have to combat this disease. It is not just Alzheimer's disease that is increasing in epidemic proportions. According to the World Health Organization, an estimated 30 million people worldwide has diabetes in 1985. A decade later, the global burden of diabetes was estimated to be 13.5 million. The latest World Health Organization estimate for the number of people with diabetes worldwide in the year 2000 is 17.1 million. This is likely to increase to at least 366 million by the year 2030. Two major concerns concerns are that much of this increase in diabetes will occur in developing countries due to the population growth, aging, unhealthy diets, obesity, and sedentary lifestyles, and that there is a growing incidence of type 2 diabetes, which accounts for about 90% of all cases at younger ages. In developed countries, most people with diabetes are above the age of retirement. In developing countries, those most frequently affected are in the middle productive years of their lives, between 35 and 64. We will now talk about insulin resistance beyond diabetes. There is a tremendous focus on diabetes today due in large part to the obesity epidemic and the alarmingly increased occurrence of insulin resistance in children and adults. Insulin is a hormone released by the pancreas in response to increased levels of sugar in the blood. Insulin resistance occurs when the insulin receptors on our cells lose sensitivity to fail to utilize insulin effectively. To compensate for the body's muted reaction to insulin, more insulin is produced in an effort to reduce glucose levels. Simply put, when we are insulin resistance, on our insulin mechanism doesn't work as well as it should. This condition leads to elevated insulin levels, leading to insulin resistance. The high levels of circulating glucose can become chemically attached to proteins and DNA and are thought to play an important role in the aging process through increased formation of free radicals, damage to the DNA, and of course ages. Many scientists, including Harry Pross, at Georgetown University believe that because of its age-accelerating properties, insulin resistance reaches way beyond diabetes to play a prominent role in the rate of aging. Common age-related disorders such as cardiovascular disease, obesity, and cancer are in fact generally recognized to be linked to insulin resistance. In addition, insulin resistance is often found in the elderly and has been linked to the aging process in carefully controlled animal studies. Disturbed glucose insulin metabolism may also adversely influence bone metabolism and the onset and progression of tumor formation and growth, again, problems commonly found in aging. Many well-controlled animal and human studies show that heavy sugar ingestion results in insulin resistance from chronically high levels of insulin circulating in the blood. This condition can lead to metabolic syndrome, a dangerous character of metabolic imbalance that increase the risk of both cardiovascular disease and diabetes. High blood pressure, elevated levels of insulin, excess weight, especially around the abdomen, and dyslipidemia, meaning a low level of HDL, good cholesterol, high level of LDL, bad cholesterol, and high levels of triglyceride, metabolized dietary fats that end up in our blood organs and tissues. There is also a largely body of evidence linking glucose intolerance and insulin resistance to an increased risk of coronary artery disease. One of the potential mechanisms by which hyperglycemia, high blood sugar levels, may contribute to GAD is thought the formation of AGEs. According to a groundbreaking study published in September in the year 2001 issue of Diabetes Care, advanced glycation end products in non-diabetic patients with coronary artery disease by doctors Konoshi, Toshijomo, and Hashimoto. Age formation may lead to oxidative stress, which may lead to insulin resistance, and as you will learn in later chapter, atherosclerosis, a major cause of heart disease and stroke, is mediated by ages. Scientists are finding increased medical complications from the formation of AGEs in both diabetes and the general aging population because of the increased availability of glucose in diabetics. This glycation formation is markedly accelerated. Consequently, those with uncontrolled diabetes age 1/3 faster than non-diabetics. We know that the ubiquitous sugar, high fructose corn syrup, fast and processed foods, and refined starches in the Western diet are major contributors to metabolic syndrome and age formation, as is the lack of healthy fats, fresh fruits and vegetables, and fibers, all of which can help mitigate the negative effect of age-producing foods. This is the bad news. The good news is that we will talk later, and we will apply the three-tiered formula of diet, supplements and topicals, each of which is designed to work synergistically to stop the destructive power of ages. You will learn cooking methods that don't promote the formation of ages and discover a remarkable substance that safely blocks the digestion of carbohydrates, allowing us to occasionally have our cake and eat it too. We will talk later about that, about foods that fights ages later in another part. And please subscribe if you are for the first time seeing this video or this channel. Share with friends, activate the bell, and make like please, and subscribe to my channel, Dr. Bassem. Welcome.